Good evening, everyone, and thank you all for joining us for stepping back onto the field. I'm Nolan Baer, and I'm the president of the CASA Soccer League of Philadelphia. For those of you who don't know, CASA is a nonprofit organization that runs adult amateur 11v11, women's, co-ed, and over 30 leagues. After suspending play back in March, we're excited to restart this fall. The league has developed its own set of return-to-play COVID-19 protocols based on the guidelines from this government and the CDC, and they've wanted to provide an opportunity for everyone to listen in to a discussion between three medical professionals that play in our league. Evan Carabelli, captain of Stony United and chief resident student at Temple, Chelsea Mariner from the Philadelphia Skyliners FC and nurse, and Dan Hanna, CASA board member, captains of Brothers Gourd FC, who is a pharmacist, will all be presenting tonight, followed by questions from yourself and the audience. Comment section. I'll turn it over to Evan to share his piece. Take it away, Evan.
Hey everyone. So again, I've been playing in CASA for years, and sorry, I'm trying to pull up my slides for you. Currently a cardiology fellow at Temple. Spent some time in the spring taking care of COVID patients that were admitted at Temple Hospital. So I'm going to talk a little bit about some just general info about COVID-19, the virus, and why we're concerned about it. Sorry, just having a little trouble sharing my screen.
Everything good there, Evan?
So can you guys see my screen okay? Some general information about COVID-19. So COVID-19 is a coronavirus, so it is a family of viruses that infect the respiratory tract in a number of different animals that are known to infect humans. So the four most common or severe, starting with SARS in 2002, MERS, which came around in 2012, and then the most recent SARS-CoV-2, which is COVID-19. And you can see that all of the more severe ones have a fairly high fatality rate for people. Determines significant is whether they affect the upper or lower respiratory tract, and that's kind of going to guide with lower respiratory tract more. So that's things like the lungs, the trachea or windpipe, and the pathways that supply air to the lungs. Transmission is primarily person to person and generally people that you're in close contact with. So the means of transition is through respiratory droplets for the most part. So that's small droplets that come out of your mouth or nose, coughing, sneezing, or talking to somebody in close proximity. Can also be spread by touching infectious surfaces that have been infected. So if somebody were to sneeze on something, you touch it with your hand, then touch your eyes, your nose, your mouth. So this mode of transmission really guides the things that we can do to try to limit transmission. So wearing a mask helps prevent spread of respiratory droplets. Washing your hands frequently helps reduce the risk of spread from touching infected surfaces. So one of the things about COVID, why it's spread so rapidly around the world, is that compared to some other viruses, it has a relatively long incubation. And you don't display symptoms for usually 4 to 5 days and sometimes as long as 2 weeks. So that means that you have a period of time where you're contagious, that you can spread the virus to other people, but you don't. It's been that means is that everybody is in a population more rapidly, and it's chickenpox. So if you think about those of us that are in our 30s, pretty much everybody got chickenpox when we were young. So that means that somebody who hasn't had it is less likely to pick it up because there's not as much traveling around the community at a given time. In terms of signs and here, and what's important to note is there's no symptom that happens 100% of the time, and also the symptoms are not unique to COVID. So there's cough in about 50% of the people. Next most common is fever, muscle aches, headaches, shortness of breath, diarrhea. Kind of noteworthy who had somebody that is pretty concerned potentially. In terms of disease severity, you'll hear a lot that COVID is mild in most people, and that is the case. These are people that wouldn't need to go to the hospital. They might feel crummy for a couple days, have a fever, but clear the virus without any real long-term outcomes from it. And then it's severe in about 15% of people, so it can cause viral pneumonia. 5%, these are people that would need to be admitted or multi-organ failure. So these people are age. Coronavirus is a lot more concerning for the older population. So this graph shows the fatality case rate globally by age group. You can see that it's pretty low in young children and then starts to creep up as people get into their 20s. Dangerous for the older population. We have a breakdown here of deaths in the U.S. by age group. This was as of June 24th. So the ratio is pretty much the same now that the numbers are increased. You can see that again, but you really do still have a lot of young people who unfortunately have gotten very sick and have died from COVID. So for COVID-19, hospitalizations, those are steroids, remdesivir, which is blood samples from people who have been infected and clear the virus ill to shorten hospitalization and slightly decrease mortality, but it's not remdesivir and you're cured the next thing. Initially were effective, but it turned out not to be effective. So originally there was a lot of talk about hydroxychloroquine and azithromycin. That's been shown to not be effective and potentially. Now is about vaccine. Haven't tested them on humans at all. And there's less than 10 that are in what's called efficacy trials, so seeing how well they work in people. And if you're wondering why there's a delay, it's because you need to do a stepwise approach where you first show that it's safe, show that it's effective, and then once those things have been demonstrated, would need to be widely produced and then distributed. So all of this process, being optimistic, would still probably be at least another 6 months or so, if not more than that. In terms of testing, there's kind of two ways that you can test for coronavirus. One is checking for the actual virus in people. So that would be getting a swab of your nose or your mouth to see if there is DNA from a virus there. These tests are really specific, so that means if the test is positive, that you have the virus, but they're only moderately sensitive. So that means there's 40 people who have the virus and are swabbed will get a negative test initially. Is not super real. Blood test, which is how your body fights a virus. This takes days to weeks to become positive, so it's not the first marker that you'd be able to test. And then the question is, sort of once people have antibodies, how effective they are in preventing them from getting the virus again down the road. So depending on the virus, there's certain viruses that you get antibodies for and might be immune for a couple months. Unfortunately, with COVID, we don't have enough data yet to say how protective antibodies are. And the World Health Organization in different states, and you can see trends. The Centers for Disease Control and Johns Hopkins has a lot of data as well. So we can take any questions you have now, or hold on till the end.
Yep, if you have any questions for Evan, feel free to type them in the comments on YouTube, and Doug and I will collect them and, ask them as they come. But I'd like to turn it over to Chelsea, present her slides.
Hey everyone. Yep, you ready? Okay. Hey everyone, I'm Chelsea. I work at CHOP as a psychiatric technician. I work hands-on with COVID patients periodically. Depends on if they're under our observation or not. I have been in the room with them multiple times. But anyway, let's move into reopening in PA. Let me get my screen shared here and present. Okay, so reopening in PA in the wake of COVID-19. So right now there's 3 phases that the governor has instilled with COVID. The red phase is the most restricted. All non-essential practices are shut down. Yellow phase, there's some opening, but it's very limited with very strong restrictions and precautions need to be taken. And then there's green phase, which is essentially everything's open, but still only to a certain % of capacity. And there's still precautions that need to be taken, and it all follows through the CDC guidelines. Within each of these phases, and counties throughout the state can vary, and it'll periodically change based on whether or not there's spikes in cases or not. The red phase is essentially nothing. The most extreme measures are taken to reduce the spread. They want to reduce as much necessary means of person-to-person interaction as possible. Schools are closed. All businesses are essentially shut down unless they are essential. Large gatherings are prohibited and stay-at-home orders are in place. Then we have the yellow phase. It's when you move in to kind of like, it's like the limbo period between green and red. There's some restrictions on social interaction will ease. Others will have to still remain in place. It's intended to reopen the economy safely and gradually while keeping a close eye on public data to ensure the spread of the disease. Some childcare can come back to work. Businesses can start bringing people in, but they don't want people to be close to each other. So as long as they're able to separate and follow the guidelines. Large gatherings of more than 25 are prohibited. That's kind of an important part right there. Masks are required everywhere. Then we'll go into green phase. Green phase is most restrictions are eased, but this one and business closure orders are kind of laid back so that way they can reboot the economy. So some phases were allowed to be in 50% capacity. Now they get to move up to 75%. 75% capacity. Large gatherings have increased to 250 people, and masks are still required. Indoor recreation, health and wellness facilities, and personal care services can open at 50% capacity, but that's all by appointment only. And construction activity can work as well. Then we have, okay, here's where we get into the transition through phases based on a risk-based decision-making approach. So making the decision to move from phase to phase is evaluated per county throughout the state and heavily relied upon statistical data. So face-to-face contact risk, nursing home risk, all these risks are in consideration on how they decide whether or not we jump from phase to phase. Risk agencies are also put into play. This is how they also get everything together and decide whether or not they should move from phase to phase. This is kind of a layout here, county scoreboard. This is current. I just checked this today as of 7/22. So right now what this does is it kind of shows where the risks are at its worst in terms of commuting and transferring from county to county. As you can see, Philly is still pretty red right there. So that's why we're kind of out of luck with our green phase. The phases via organized sports, professional sports are back, but no fans allowed in the stands. Some of it's kind of up to the discretion of the venue. But CDC guidelines are the main thing that people need to follow. Collegiate sports, they can come back as well in the yellow and green phase, but they do have to have a safety plan in order to be able to resume play. All sports-related gatherings must conform with the gathering limitation set in accordance with the green. So they can't exceed having 25 people if they're in yellow, and they cannot exceed 50% of occupancy. Then we have pre-K to 12 sports. They can also resume during the yellow and green phase, all permitted with the PIA and PISA in order to come back, and they all have to have a contingency plan. And then we have recreational and amateur sports, and that's where CASA comes in. So recreational and amateur sports cannot resume until we are in green phase. And a list of all PA safety guidance to be followed in attendance. You can find that at this site right here. So the Philadelphia reopening plan, currently Philly is in a restricted green phase. Mayor Kenny has banned all large. This doesn't apply to private outdoor events with fewer than 50 guests, recreational sports with fewer than 25 participants. And that's where it kind of hurts us, because you think about it, 11v11, 22 people, then you got to add the refs and substitutes. We can't do that here. Events on private property, including performance venues and stadiums. The health commissioner did make a statement that when it comes to the large events with spectators, he thinks that games can be played with safety precautions, but he doesn't think that spectators should be at the games because there's no way that they can socially distance enough and be safe. Here are some Philadelphia reopening guidelines. So this is for when we do go into green phase. These measures still have to be followed. And you can find this on the reopening, it's like phila.gov. So what the reopening plans means for CASA, this is the most important slide. Due to the mayor's most recent decision banning events through February, we can resume our 77-88 leagues for the fall, as any site used for the small-sided will only allow players and refs to attend those. So no spectators at these events, please. Our 11v11 leagues for the fall are intending to use fields outside of city limits that do not fall under the mayor's mandate and are active under PA Governor Green phase. All school district fields which includes Germantown, Lincoln, Gratz, Northeast, and South Philly Super Site will not be available for the fall 2020 season. So as of now, all of our games can only happen in city limits if they are on privately owned facilities and currently the only privately owned facility that we play at is James Grant Memorial, but we have not heard back yet on whether or not we're going to be able to use it or not. So we are looking outside of city limits in order to play our games. And this is some sources and further reference. And that pretty much wraps up my slides on reopening.
Thanks, Chelsea. Yeah, I like to add, especially on the end of Chelsea's slides, about where CASA can play. That's important. But what the mayor issued that statement that said, thanks, Chelsea, that any event on publicly owned fields, so that includes the super sites, anything owned by the Parks and Rec, there's a limitation on how many people you can have on there. If it's a private field, some of the schools, some privately owned land, that doesn't necessarily fall under that. CASA usually plays its game on South Philly Super Site, Germantown, Ramp, all those fields, and that's where the area restrictions are. So it's possible to play small-sided there, but not necessarily MD11. So to prepare for this, CASA has lined up alternate field locations, which we'll be releasing next month, of where we'll be playing, so we can have the fully fledged 11v11 league, and still run our small side leagues as well, and still follow all guidelines and prescribe the plans. So thanks, Chelsea. I'll introduce Dan Hanna, who's going to present his slides.
Hi, everyone. My name is Dan. I've been with the league since about 2012, and I'm captain of the Brothers of the Gourd. I'm a pharmacist by profession, and at the beginning of the quarantine and the pandemic, I actually found a job where I've been working remotely. And initially, I was actually on a project that was specifically to help answer questions from patients and doctors about different treatments and potential treatments regarding patients that had COVID or may potentially get COVID and have interactions with various medications they were taking. And so I want to share my slides and get started here. Can everybody see my screen?
Yep, great, Dan.
Great. So we wanted to talk about all of the changes that have been going on and what we should expect as we go forward in regards to how we're going to adapt to the new normal. So this isn't meant to be authoritative or a definitive understanding of everything, but I just want it to be a general overview of different facets of the world that are changing now, and just to give us some ideas to discuss and things to think about going forward. So starting off with the most important thing, the new normal for CASA. Since the CDC considers team sports to be a medium to high risk activity, we've introduced the CASA Soccer League COVID protocols. There's a whole host of different precautions that we're going to be taking regarding wearing masks and not having spectators, and also keeping distance on the sidelines and how we arrive to the field, trying not to have a crowd at the field at any one point. So the referees will be enforcing the different protocols, and I would make sure to maintain a distance from the referees and don't get as close as Ronaldo here. Okay, and so in regards to healthcare, we're going to be seeing a lot more telehealth if you haven't already. This has the potential to be the new normal going forward, where a lot of things that we're finding out can be done over a Zoom or a video call. Will just continue to be done that way. People are finding it convenient, the doctors and the patients, perhaps. With the virus, widespread testing is going to continue. Contact tracing and possible quarantines regarding people if they've been exposed or if there's a chance they have been exposed. we're waiting for treatments and vaccines, and doctors are doing research, and doctors are actually just treating people with different things as we've been going through. And we've heard stories about hydroxychloroquine and remdesivir. And there's potential for new things to emerge as effective in treating patients. But for the time being, we don't completely know what treatments are effective. And of course, we're waiting for a vaccine to come out, which Evan mentioned at the earliest might be within 6 months. So at this point, there's no end in sight, and there's no definitive final end of the coronavirus pandemic. This is having an effect on a lot of people's mental health. It's a very uncertain time for a lot of people. It's causing a lot of anxiety. People are seeking mental health treatment, and probably will be well beyond the end of the pandemic. And another thought was that we might be wearing masks for a long period of time. We don't know how much we will. We're all going to acclimate to wearing masks as a general precaution, because we don't know exactly when this is going to end, and even afterwards, people still may be apprehensive. As far as work goes, a lot of people are working from home, and sometimes it might feel like you're living at work, actually. There have been a lot of layoffs in the country. A lot of people are unemployed. And then there's always the question of, are we going to get shut down again? Depending on the flare-ups of the virus, and how that's going. Different governors in different states have adopted different policies and regarding what can be open and what can't be, and sometimes they've gone back and forth. One positive, I think, is that a lot less people have been commuting. Personally, I've enjoyed that. The roads are quieter, and actually, you're saving a lot of time because you're not having to commute, and you also get to work in sweatpants, so that's a plus. With my own company, just speaking from my experience, it sounds like there isn't any urgency to return back to the office because there is so much apprehension and uncertainty about whether it's safe. What do we do if one person in the office gets the virus? Do we quarantine everybody? Do we just simply wipe down their desk? They're implementing temperature checks at the door, but we actually haven't gone back to the office yet. So we don't really know how that's going to look. As far as our social life, there's been a tremendous impact on that, as far as not being able to go outside as much or be in groups as much, especially. There are a lot of travel restrictions for people traveling from the U.S., and there's only a handful of countries that are actually allowing us to travel to those destinations. So a lot of people have been taking road trips or doing things that they enjoy locally. Social distancing is an obvious change that we've gotten used to. I saw a sign on the highway that asked people to practice COVID courtesies. I kind of like that phrase. So it's just a matter of having some manners, I suppose, or just kind of regard for other people. And the way I've seen that play out is that if you're walking by somebody on the sidewalk, it's pretty common to have both parties kind of split to the other side of the sidewalk to give each other 6 feet. So a lot of people are spending more time with their family, for better or for worse. And that's difficult for a lot of people that are working and have children around and things like that. But for other people, it can be a joyful experience where you can bond with your family more than you used to. A lot of people are exercising at home. There are a lot of different devices that I've seen, different apps for yoga and various things. Peloton, of course, has become popular, and that's just going to become more normal. People are seeing their friends and checking up on each other through Zoom calls rather than actually getting together to meet. And it's also having the time at home has given people an opportunity to be creative and find new hobbies. And I know I spent a lot of time playing Animal Crossing at the beginning of this, but it was kind of a relaxing way to just settle into the situation. As far as bigger things go, as far as the economy and the government, we're experiencing various degrees of shutdown throughout the economy, and that ebbs and flows depending on the virus. The economy's in a recession, and people are discussing whether we may enter depression, considering how many people have lost their jobs, and various businesses that aren't able to operate as well as they used to under the current situation. So there's job losses, and it's been made clear that there are major income and health disparities in our society, and that has worsened the impact of the virus on certain demographics. And so that's something that we may need to address going forward, as far as how prepared is our society for something like this to happen in the future. How strong is our safety net? Education has been obviously a hot topic the last couple of weeks, as far as whether people should go back to school in person. Is that safe for the children? Is that safe for the parents and the teachers and all of the staff in the facilities? There's a chance that we may just adapt to the electronic education over the internet, and some people may choose to continue that way. And since the economic impact has been so severe, this may lead to a reassessment of different priorities in our government and what we fund. When people are in a state of desperation, we might reconsider what we actually need versus what we want. And all of these factors have led to an increased chance of social unrest. So I don't mean to sound so dour about this. There are some significant downsides to this, but there also is an opportunity to improve things going forward, and to adapt to the situation and make things better. And so that's all I have. So I hope some folks have some questions, and I appreciate everybody joining the talk today.
Thanks, Dan. I have a few questions too myself, just all three of you. So if you guys turn on your mics and chime in where you feel it's best. So going back into Dan, going back onto, and anybody feel free to answer this, but Dan, so just looking back at your slides, you identified soccer as a medium high risk activity close to the beginning. What are some other activities that would fall in this category that may be non-sport related?
Let's see. Well, like a small party at your house, like if you had a dinner party with like more than 10 people, I believe that falls into the medium or high risk area. The first things that come to mind are other sports, actually. But I could find that list. It was a CDC kind of graphic that I found that on.
No, cool. That answered. Thanks. And going back to, I guess you may have answered this earlier in your slides, Evan. But back in June, CASA established COVID-19 safety protocols that Dan mentioned as well for when we return to play. This includes masks to and from the field, captains wiping down their area with wipes provided by CASA before and after games, and referees given the ability to enforce some of the guidelines through traditional disciplinary actions such as red and yellow cards. How long would you guys, based on the current pandemic climate, how long do you expect to see at least something like these guidelines in place from CASA?
So I think that as long as there's kind of any viral spread in the community, that it makes sense to have those in place, especially because they're things that wouldn't limit our ability to play. So having people wear masks, having people wipe down surfaces, wash hands, try not to be on top of each other when they don't have to be, is something that makes sense to keep in place probably until there's almost no COVID in the community.
Cool. Thanks. And then, Dan, going back to some of the other stuff you're talking about. So and you guys might know the answer to this, what are some easily accessible locations that people can be tested for COVID-19, and what are the approximate costs of that?
Yeah, so I actually got tested just a couple of weeks ago. I was kind of risky and went on a trip to Delaware with a couple friends at the beach, and thought maybe I should get tested when I got back. So my girlfriend and I, we just looked it up online, and actually Rite Aid has a few locations in the city where you can just do drive up. It actually took like 10, 15 minutes, and it was pretty straightforward, didn't cost anything. And I think urgent care facilities are doing some of that too. I'm sure there's other places too.
Cool.
Yeah.
Going back to about the vaccine, Evan, I know you mentioned that it's looking like it'll take roughly 6 months for a vaccine to come about. I know that's not, it's not going to be definitive. There's a lot of factors that go into that. What would be the rollout process for when the vaccine is produced? What's the normal rollout process for a vaccine?
So the biggest limiting factor, or I guess there's kind of two limiting factors usually. So the first is developing something that's shown to be effective takes a good period of time, because you have to have people get the vaccine and then have enough time that they've been exposed to COVID and see that they don't contract it. So that takes a period of time. And then the other thing is physically making enough vaccines to distribute to people. So typically, once a vaccine is developed, it still takes months probably before you get because it's a global pandemic, literally billions of doses developed. So, I mean, it's months on both ends, the development and the distribution.
Yep, and it's probably right to say that it would be provided to the most vulnerable groups first before being distributed to the rest of the population. Is that correct?
Yeah, absolutely. So at-risk population, so individuals who have pre-existing medical conditions that put them at higher risk, individuals that are working in an environment where they're more likely to get COVID, be that somebody who's driving a bus and interacts with a ton of people, or somebody who's a healthcare provider who's interacting with patients.
Cool. Okay, thank you. Chelsea, question for you. This one is a little bit of a mouthful for me, so I'll try to get through it. So if we look back to Philadelphia was set originally to get to the green phase in early July, and obviously that was repealed. We went into a modified green phase, but we had started that modified green phase a week earlier, where some businesses like restaurants and bars were allowed to open with capacity rules and other protocols. So they were kind of in effect, and they continue to be in effect for the month of July until we hopefully get into the green phase in early August. So let's just say worst case scenario that we get into green phase and then it would be repealed back to yellow. Do you think any businesses or organizations that opened in green phase would be allowed to continue under strict guidelines? Or do you think they would all get pulled back?
So I think they would all get pulled back. It's actually already starting to happen in a couple places in Jersey, where they were allowed open and they were about to do indoor dining up to 25% capacity. And then all of a sudden, 2 days before they were supposed to reopen, the governor said, nope, put it back, and actually shut them down. I have seen places get shut down immediately. It's really hard to tell because it's all up to the discretion of the governor. I think that places will definitely get shut down again, though, unfortunately.
Yeah. Okay. And then, Dan, I know you mentioned contact tracing in your slides, and anybody else feel free to chip into this too. In your guys' opinion, what would be the best way for the league to carry out contact tracing in the event that we unfortunately had a positive COVID test within our league members?
I think the biggest concern might be HIPAA as far as naming anybody or directly identifying who it was. So we would have to find a way around that where we could identify who it was, but not out loud in public or, in any violation of HIPAA. I don't know if that gives us a solution, but I'm just thinking that's the one thing we don't want to do.
Somewhat, yeah. So I'll touch on a little bit too. In the CASA protocols that were developed, kind of how we were going to carry that out is if there was a positive test, it's important that the whole league knows that a positive test occurred, but they don't need to know the person's name or necessarily anybody else involved. So, the league stance on this was a message would go out saying an individual playing on this field at this date contracted a positive test for COVID, no name mentioned to anyone, and then we would kind of go back from there, trying to figure out who they could have been in contact with. At least that's how the league set it up. And
Yeah, I think that sounds reasonable.
hopefully we don't need to engage this. And then building on top of that, I don't know who would be the best person to answer this question, but if the league restarts successfully during green phase, how many cases would it take for the league to have to close back up just for safety purposes?
So in terms of cases involving players,
Yeah.
so I think it's probably hard to draw a specific line, but the thing that would be most concerning to me is if you had multiple players involved at a particular site who ended up coming back positive. That would be kind of a little indicative of it could have been related to that game rather than somebody who had picked it up in the community and happened to test positive. But the fact that there's multiple sites involved and so many players, I don't necessarily think that a single positive test would preclude people from playing at other sites.
Okay. Thanks for sharing, Evan. We do have a couple questions from the audience. So first, just some background. Right now, the CASA protocols for wearing masks is to the field, on the sideline, not on the field, and then back on the sideline, leaving the field. Someone asked, I've been wondering if you all would recommend wearing masks while playing soccer. Is it helpful? Are there mask materials that would balance strenuous activity and limiting potential transmission?
I think there's a couple factors to that.
Actually, I'll take that one. I actually have.
Go ahead.
Oh, go ahead, Dan. Go ahead, Dan.
No, it's all right. You'll probably get to whatever I was thinking.
Mine's a little. My screen's a little bit delayed, so I didn't know you were starting. So I have this mask. It's called a gaiter that I wear, and it kind of just sits around your neck, but it sits up really nicely, like right here. And when I wear it, it's very easily breathable, and they actually have antibacterial ones online that you can buy, and it actually helps with keeping you cool too. You can also like wet the bottom of it. Don't ever wet anything that's going to be on your face though, because if it's wet, it's actually less effective against being protecting. But you can wet, like, say half the bottom if you want it to cool off yourself a little more. But you can breathe in it just fine. Like, I actually tested it out earlier at the gym, and I could breathe very well. The biggest part.
No, go ahead.
What'd you say, Neil?
Oh, sorry, Chelsea, you can continue. It's freezing.
So the biggest thing that masks are to prevent is not so much to protect yourself, but to protect everybody else, because when you talk, you spew droplets out of your mouth or sneeze or anything like that. So just having any piece of material that you're able to breathe behind will help keep all of your spit and all that stuff concealed in a mask instead of onto your pliers.
Cool. Thanks, Chelsea. And to add on to that myself, I have an N95 athletic mask I've been wearing. I've tried it while playing some pickup. I've tried it while going to the gym and running. It's difficult. I wouldn't say it's difficult to breathe. It's more about the sweat, which will be less of a concern in the fall. It's definitely doable. As of now, we're following the guidelines that the CDC's provided, and if a player feels they want to wear a mask, that's totally fine. The gaiter is a great option too. We're looking into having gaiters printed to be the CASA mask that we hand out in the fall through Icarus. So we're still working on that. We have about 6 weeks out, but that would be a cool option as well, and every player would have one of those. Let me go to a couple other questions we have. Somebody asks, what concerns do each of you have about playing in CASA leagues in the fall?
Yeah, so my team is planning to play. Risk factor is going to be how prevalent the disease is in the population. So if the community rate in Philadelphia and the surrounding area is pretty low, then the risk of playing is similarly probably pretty low. But if the community rate starts to get higher, the risk that any one player on the field is infected becomes higher. So I think it's really going to be dependent on watching the numbers in the community, and as long as they stay low, it's probably pretty safe. And if they start to creep up, it gets less safe as the numbers go up.
Right, and to add on to that, I think recreational sports is one of the things that they're definitely keeping a tight hold on. So if we are in green phase and CDC's plan to continue, then likely the infection rate is pretty low. But if we're back in yellow or modified green, where the CDC doesn't say it's safe to play, then CASA wouldn't be running. So, how about you, Chelsea and Dan?
Our team is planning on playing. I think we had about over 20 people that came back to wanting to play. I guess are exactly the same stuff that Evan said. The biggest concerns is just the rate within our community.
Yeah, I'd say hesitant, and like Evan said, it really depends on what the virus looks like. As far as we can see, if it's getting worse, then there's more apprehension. But most of us really want to play, and we were planning to in the summer until we went back to like yellow phase. So that was a bummer. But.
And yeah, my team or teams are planning on playing too. It's not 100% of the players. It's maybe like 80 or 90. And my stance is if the players don't feel comfortable playing, that's totally fine. We're supportive of. Some people have certain circumstances where they don't feel safe or they feel that they're going to be in a position where they're spreading it. So that's totally fine as well if they feel that way, and they can come back to us when they feel ready. So. And then I think this is.
I guess really one thing.
Sorry, Chelsea. Go ahead.
It's so in such a delay. Just one thing that I really want to just point out to everyone that's watching this right now is like, if you are symptomatic at all, do not go and play. I think it's if you have a fever of more than 100.4, you definitely shouldn't go, and don't pass it off as a common cold or anything like that. Go get tested and do not come and play. If you think that you've been exposed, do not come and play because it can just put everybody at risk. That's all I wanted to say.
No, thank you, Chelsea. And that, we did send out the COVID protocols on June 27th. They were originally for the summer season, which we had to, peel back, unfortunately. But it's good we got them out early so everybody could read them. I'm not going to read through the whole thing. It'll be sent out again before the fall. But the first bold statement is, if a player, coach, or referee feels ill or spectator, do not attend. And I think that's the most important thing. It's the same thing as if you don't feel well, don't go to. If you're in a position where you're working right now with other people, you don't feel well, don't go to work. So it's that's the first thing we want to emphasize, definitely. A couple other questions is I think that one's answered. Dan, this one's for you. Quick question: will the season be bring your own gourd, or will they be provided?
Yeah, so I'm glad that question was asked. So, the gourd is very important to the brothers of the gourd. What we'd usually do is pass it around, and we'd all take a sip of the mate, to get fired up for the game. But that is explicitly prohibited in the CASA COVID protocols. So we're going to figure it out. We're all going to get our mate, but we're not going to pass a gourd around and share spit. So.
Yeah, definitely. And especially, I'd like to add, and this is addressed in the code protocols as well, but, in the early weeks of the season when it's hot, it's important that everybody brings their own water. We're not sharing water. It's important that everybody kind of understands that, some teams, sometimes you forget your water, but, if you forget, that sucks. You can't share water with a teammate. And another question we just got was still no specific. So we are planning on restarting Saturday, September 12th. We were actually going to blast that on social media tomorrow. We're pretty excited about it. The board is still working hard on getting all the fields secured. We're almost there. It's been a long summer, but we're excited about it. Gotta have another question here. So the situation doesn't happen right now, but how could you see quarantining after crossing state lines to play? Would you feel it would be necessary if New Jersey added PA to a list, or vice versa?
Yeah, I would think that if there is like strict criteria from the states, then we'd be beholden to that. But in terms of if you live in New Jersey and you're commuting over to play a game in Pennsylvania, as long as the rate in the community is similar, then it's not necessarily an increased risk. But if, for some reason, like Collinswood, New Jersey became a huge hotspot for COVID, but Philadelphia wasn't as high, then yeah, it's probably not great for somebody living in Collinswood to come over and play. Nothing against Collinswood.
And we actually, speaking of New Jersey, we are working on a few South Jersey sites for CASA. This would be the first time ever, so we're excited to hopefully the states stay on the same page with low infection risks, but we're looking forward to that as well as our expansion continues. More of a fun question. Who do you think will win the Champions League?
Liverpool. Maybe.
I think Liverpool got eliminated, Dan.
Yeah,
I meant next year.
How did the game go today?
Liverpool won 5-3.
I bet, but I didn't check.
Oh, yeah.
Yeah.
My is on Bayern.
Chelsea fan, that hurts.
I'm going to go Atletico. I think this might be the year that Simeone finally gets it done.
Nice. I guess we'll see. The Champions League final is scheduled for Sunday, March 23rd. So we'll see in a month from today. Okay. I don't have any.
Be safe.
Yeah, I would say just keep doing the small things that people are doing to help decrease transmission. So wear a mask when you can, wash your hands, don't share gourds with people.
Maybe in a couple of years, Dan.
Yeah, I'm looking forward to it. One of these days we'll get back to it.
Yeah.
But yeah, like Evan said, it's like all the wearing a mask and keeping distance and just trying to be disciplined about that stuff. It's pretty important. As much as it seems like you might not get really sick, the virus is real. So just, I guess, act like it's a real thing.
Yep. Okay. Well, on that note, CASA would like to thank Evan, Chelsea, and Dan tonight for their time, and a big thank you to but pull this all together. This presentation discussion was informative, and we're excited to kick off the fall season and bring back soccer to Philadelphia in a safe and fun environment on September 12th. If you have any further questions, don't hesitate to reach out to us at communications@phillysoccer.org, or you can check us out on the web at phillysoccer.org as well. So thanks everyone for joining, and stay safe.
Thanks everybody.
Thanks, guys.
And we're clear.
I was gonna say, should I leave? I talked way too fast. I might have left.
No, it was fine. It's fine.
I'm sorry.
No, you slow down. You guys did a great job.